This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. The first question I got was, how do you find the energy? And it is, so the first trimester, you definitely suck a lot of energy out of you. You're just like constantly fatigued. There's hormone surges and just you're very fatigued. You can have 200 milligrams of caffeine a day. I think that is the limit. So take with that what you will. If you're a coffee person, I was definitely a coffee person, and I was never really a tea person. But I think I was starting to cut off coffee altogether before I was pregnant. I started taking this stuff called mud water, which maybe you've heard of it, but it's actually mushrooms. It's like 7 different types of mushrooms, and it tastes like mud. I mean, it doesn't taste great. I had used like almond milk and honey in it and stuff, but it had like more nutritional value, and it was like 1/7 the cup of coffee. So I was drinking that before I got pregnant. So I kind of like weaned myself off of coffee, and I actually stopped drinking the mud water when I was pregnant, because there's one mushroom in there that I think increases your blood volume, and you're already increasing your blood volume being pregnant. So I think it puts you at risk for bleeding. So I think I had talked to a friend of mine is a Chinese medicine doctor that like does a lot, like, knows all about herbal, mushrooms and remedies and stuff. And so she gave me that recommendation to probably best not. But take with you what you will. 200 milligrams of caffeine a day. Let your charge nurses know if you're pregnant, if you want to, because they can sometimes help with assignments. That can certainly be helpful. First trimester is hard because you feel the worst and you have the most symptoms because your hormones are going crazy, but you're not showing and you're not telling people. So you're just kind of silently suffering by yourself. I think I called out a couple times during my first trimester. And so like know what your policies are about call outs and use your best judgment, take care of yourself. But yeah, sometimes letting your charge nurses know that, hey, I'm just really, really feeling fatigued. Sometimes they can help with maybe giving you like an easier assignment. And then just obviously rest as much as you can when you're at home, because you're building an organ and you're growing a baby. So 12-hour shifts are hard baseline, but yeah, I think that's what I did.